University of Wisconsin Hospital and Clinics is 6 hospitals centered around Madison, Wisconsin, and we have facilities down in northern Illinois. We have 90 clinics around that area, and we also have 6 joint operating clinics between different hospital chains in Wisconsin. Operating environment pre-Nutanix was kind of a mismatch of everything. Procurement of those environments also was based more on a project approach, so there was no consistency between what we were doing. We were running out of capacity. We needed to simplify what we were doing. The environment was way too complex to deliver services, and we weren't doing a good job delivering those services. Basic access EMR would not be available for hours at a time. We wanted to make sure we were doing the same thing everywhere and make it as simple as possible. And that's really what drove us to the Nutanix solution. Nutanix running on the Dell EMC XE series could accelerate and help us deploy quickly. We had some legacy systems that we had been struggling with for 4 months, and at that point still hadn't gotten to the point where we can go production, where we were able to do that in 5 hours with Nutanix. The cost savings were huge. The agility to the organization were huge. My experience so far with the Dell EMC Nutanix support services has been great. We've had teams in doing our initial deployments and getting our clusters set up. They work so well together, delivering one solution to us. Epic is our EMR that we use at all our hospitals and clinics, and we deliver that using Citrix technology on top of Nutanix. Before we had gone to the Nutanix platform, we were seeing outages of a couple minutes to a couple hours. Our logon times were averaging 2.5 minutes. So every time a doctor or nurse went to a patient room, they'd have to wait that long to log in and before they even start talking to the patient. With the capabilities Nutanix has brought in, we've been able to get that logon time down to 8 to 9 seconds. So we've given that time back to the doctors to actually spend with their patients and the nurses to do their jobs. And we took the first step of doing the application delivery, and then we moved into more of the ancillary systems that supported the Epic environment. Right now we are running our hyperspace servers, which is the client access piece with Epic. We are running our business object environment, our data warehousing, SQL servers all run on Nutanix at this point. So the reason we chose the Nutanix Enterprise Cloud was the simplicity. The selection criteria was really trying to streamline and become more of a service provider to our organization. We were tired of having to pay multiple millions of dollars up front to put storage in that we might not use for a year or two, or to compute in or networking. Nutanix really gave us that ability to build it as a Lego piece. Before we had gone to the Nutanix platform, the upgrades would take about 36 hours to complete. We've been able to put the process in place using the functionalities of Nutanix, and we have that upgrade down to 5 minutes now. We've cut that environment down and that outage to our end users from a day and a half of being impacted to them not even realizing that they didn't have systems available to them. We started off with a fairly good sized cloud environment of 24 nodes, and then we've grown to 220 nodes in the last 18 months now. The performance we've seen compared to the expectations is they've exceeded everything that we were looking at. We've gone from easily 20 racks of equipment spread throughout the data center to 3 racks. The financial benefits to UW Health have been quite substantial. Last year, we were actually able to give back a couple $1 million in our budget that we ended up not spending because we didn't need to buy as much equipment. We didn't need to pre-buy storage that we would need a year from now, or compute we needed a year from now. The other part that we've really benefited from is the enthusiasm that the administrators and analysts have taken to it. It's helped out with that morale and the guys working together and the teamwork to making sure that environment's up and running the best it can. The future of Nutanix at UW Health is really the foundation for all our services we're looking to deliver. It is our platform that we're putting all our workloads on. We are looking to expand disaster recovery capabilities with the metro clustering. Nutanix really gives us that platform to be able to do that.